All right, so you've made it to phase 3 of your knee replacement surgery. You're a couple weeks out from surgery and you're looking to increase your mobility and the strength in your leg so you can function back to normal. This video specifically focuses on flexion or bending your knee more. If you're looking to work on straightening your knee and getting past some hurdles there, click on this little card so that it'll take you to that video and you can see how to do that. So now that we're trying to progress the mobility and strength of the bending in your knee, the first exercise that I'm going to give you for this is a banded seated hamstring curl or banded knee bending. So what you're going to do, get your band and anchor it around either a table leg or a pole, something really nice and stable that's not going to move. And then you're going to put your foot through it like so, just around my ankle here, sit up, and then I'm just going to bend back to whatever I feel comfortable. Now, you'll probably feel some tension in the back of your knee. That's fine. That's the muscle that's responsible for bending your knee turning on there. And I want you to repeat this one 2 sets of 10, 2 to 3 times a day. The next exercise I recommend to progress your bending is a Swiss ball hamstring curl, which I'll show you in a second. If you don't have one of these guys, what you can also do is just get like a bath towel or even a hand towel and then put it on a slidey surface. If you're able to get down to the ground, great. If not, if your bed sheets are slidey and you're able to slide your socks on them, great. Just to try a different option if you don't have one of these balls. But what you're gonna do, laying down, oh yeah, right here, and get my feet up on it. From here, I'm gonna bridge my butt up so my legs are straight, my butt's off the table, and I'm gonna roll my legs bent up like that to me. Now, you can absolutely hold your arms down, especially if you're just starting out with this. To make it harder though, you can take them away and work that stability of the muscle. Try this one for about 5 to 10 reps, especially if you're just starting out, to whatever you can tolerate. The last exercise we'll go over is if you're really having trouble getting that knee bending back, if you're stuck in a fairly straight position, what I want you to try. Now with knee bending, what I typically don't recommend that we really force it and crank on it to try and get that back, which is more of an old school way of thinking, just because then the brain kind of shuts it down because it's so painful. It's just perceiving that this is a threat and I'm going to stop all movement and get my muscles to guard and be really painful and stiff. So we don't want that. We want to build up strength and confidence in that knee and muscle that is responsible for bending your knee progressively. And then as you get better, you can go further and further. So this is what the exercise looks like that if you're really struggling, you can try. Now I have it set up like this to give you a visual, but ideally if you have a recliner, you can do this exercise with that perfectly fine. What you're gonna do, say you're starting out pretty straight, you're having a hard time bending the knee. So you can start out with that recliner footrest further out. And what I want you to do is push that knee bending back, hold it for 5 seconds, and relax. Your goal is to feel some tension, some activation in the back of the knee muscle right here, and just hold it for 5 seconds. Now I want you to repeat that about 10 times. And the thing with this is as you get further and further, as your knee bends more and more, you can push that recliner back further to further back distance. So just as an example, say you get to here, you're doing the same thing. Hold for 5 seconds, repeat 10 times, and then eventually if you're in a kitchen chair or somewhere, you can push further back, hold 5 seconds, repeat 10 times until you're at the desired flexion range or bending range that you want. I hope that helped you get some of the bending back in your knee after your knee replacement surgery. My name is Ganzer. I'm a doctor of physical therapy. Go ahead and check out this video if you're interested in going back up and down stairs again normally with both legs after your knee replacement surgery.